Good evening. My name is Jessica, and I apologize in advance. I have laryngitis or the beginning of the flu, so I'm really hard to hear, but I have gone ahead and posted all of what I'm about to talk about in the discussion board this week. So the proposed question was to analyze and compare the three approaches of fiscal management. So there's the three approaches or the three viewpoints are financial, process, and clinical. So process, they work with the system organization, responsible for things such as data accumulation and report creation. Financial, um, finance is their daily job, responsible for strategic planning, financial reporting, um, and other items such as that. And then clinical is direct patient care, operations of a clinical facility, and day-to-day interactions with teams um, within the medical establishment. So there are four elements to financial. I apologize. It hurts just a little bit. There are four elements to fiscal management approach. Those are planning, controlling, organizing and directing, and decision making. Planning is steps to meeting organization objectives, creations of budgets, things along those lines. Controlling is report review, confirmations of adherence to plans, really just kind of being in and hands-on to make sure that the things are going the way that they're supposed to. Organizing and directing, delegation of finances, as well as management of effective resource use. And decision making, it really occurs parallel or at the same time as the other three elements. They're information reliant, analysis and evaluation driven, and informed decision making is the ultimate goal of this element. The second question to this week's discussion was if you have seen one at play or encountered one, describe it. So I am Center Operations Director for the second largest Concentra Urgent Care in Colorado. I oversee a center that sees on average about 150 to 155 patients a day. I have a team of 14 staff, 4 providers, and 3 therapists. And we have a finance department or an accounting department that creates all of our budgets and delegates how certain funds or the amount that certain funds should be used for and items like that. But as the director, not only do I handle the people management side of things and the day-to-day interactions with patients and patient care, but I also am responsible for monitoring things such as the use of funds that have been delegated for each department. So things such as central supply ordering. So those are going to be our items like crutches, walking boots, point of care testing, and then our therapy department ordering. So things like electrodes and different weight materials and other therapeutic modality needs, as well as labor. So I'm responsible for monitoring my efficiencies, making sure that we're staying within staffing needs, and adjusting appropriately if not, of course. And purchasing of office supplies, so water, paper, cleaning supplies, anything, pens, markers for our board, anything like that, I'm responsible for the overview of. So I'm given a budget at the beginning of each year, and then it's broken down into each month and I'm responsible to adhering to that, as well as making sure that the clinic is on track to hit what the expectation of the facility EBITDA was. So I get the clinical approach to it all, and then I get a view of the other two, as far as financial and process. I work quite closely with the other departments. Um, like I said, I apologize. I'm gonna put the rest of it into my into board online, and I'll type the rest of it out. Um, but I was holding out long enough at the end of the weekend, hoping that it would clear up, and unfortunately, it's just getting worse. So I appreciate your time, and I look forward to watching the rest and responding. Have a great evening.